Hello, everyone. Well, it's 2:30, so we'll go ahead and get started. If any of you have questions during this, you can add them to the chat, and pending time, I will get to them at the end. If not, then I can always message you if you're one of my patients in the portal, or definitely send me a message in the portal if you have questions about anything that I went over here. So for any of you who do not know me, my name is Dr. Alyssa Cooper. I am one of the naturopathic doctors here at Living Wellness Medical Center, and I am doing my webinar today on allergies, histamine intolerance, and Mast Cell Activation Syndrome, also known as MCAS. I know that that is a lot to cover in a short webinar, but my goal is to really just do an overview of these conditions, talk a little bit about their differences, how approach to treatment might vary depending on what's going on, and really to bring awareness to MCAS because it's very complex and much more common than you would think. And it's something that I think is important to bring to your doctor's attention. If you hear what I go over and it resonates with you and you think that it could be a missing piece to the puzzle. So let's go ahead and get started. So first, kind of general overview, what is an allergen? An allergen is an environmental substance that triggers an abnormal or heightened immune response in susceptible individuals. So allergens can vary from food, environmental, medication. There can be so many different allergens or things that the body, again, identifies as an allergen when it is exposed. So allergens are typically proteins or glycoproteins that are recognized by the immune system. So we have different types of antibodies in our immune system. So for allergies, that response is typically mediated by the immunoglobulin E or IgE antibodies. And again, sources and routes of exposure. So sources could vary. Foods, so common ones within foods would be tree nuts, dairy, fish. Those I see most commonly, but again, you can have an allergy to honestly any food if your body creates those antibodies. And then plants, so plants or things in the environment, specific trees, different animal elements, and then supplements and medications. So not just medications, people can have allergies to supplements as well. So that is something that is important to be aware of when you're trying new things with your provider. And then routes of exposure for allergens, you have inhalation, ingestion, and then skin contact. All right. I like this graph. It is a mix of both complex and simple. So that is why I like it, but it helps to differentiate the sensitization process and then the actual allergic reaction. So initially, when you're exposed to something, when you're exposed to an allergen, that gets into your body, again, by those different methods of ingestion, inhalation, contact of the skin, and then your body essentially will make antibodies to that allergen, and those antibodies will be on your mast cells. We'll go into a lot more depth about our mast cells, what our mast cells can release, but then that's the initial response. So you typically don't have actual symptoms when you're initially exposed to an allergen. It's really the next time that you're exposed to that allergen that those antibodies are primed and they're ready. And then that allergen is able to bind to those receptors. And then the mast cell itself releases histamine or other mediators. So it's not all about histamine. We will focus on histamine today, but there's other mediators like leukotrienes and prostaglandins that are released from those mast cells as well. And then when those mediators are released, you'll experience an allergic reaction. So the types of responses that you can have when you're having an allergic reaction, many of you are probably already aware, but you can have cutaneous responses, so hives, some redness, some swelling, some itching of the skin. Some people have very extreme hives or just lots of redness, even if it's not demarcated as hives. And then you can have respiratory symptoms. So some people, again, more nasal. Others are going to have more ocular, so dry eyes, itchy eyes, some discharge, or respiratory, cough, wheezing, difficulty breathing. Those are possible symptoms that you could have. And then gastrointestinal, some nausea, some pain, reflux, vomiting, diarrhea. I would also include, bloating, constipation is here, more as like long-term, not necessarily immediate effects. And then cardiovascular, you can have an increased heart rate, low blood pressure, dizziness, fainting even. And then we don't like when anaphylaxis happens, but that again is, a severe systemic reaction that happens to the body. And so that is important to think about. And those individuals who have had anaphylaxis in the past should always have an EpiPen on them and be very aware of their allergies, of course, and communicating that to people that they know. So what is histamine? I know I said that histamine is not the only one that is released by the mast cells, but it is a very important one, especially when we're thinking about different over-the-counter medications, supplements, things to use that can help to reduce histamine in the body. So histamine is a compound that's released by white blood cells, so primarily mast cells and basophils in response to a perceived threat. That perceived threat could be an allergen. Typically is an allergen. So the body looks at something that is not actually threatening or shouldn't actually be threatening, and then views it as a threat and has that whole cascade happen that we looked at earlier in that picture. And then histamine will trigger an inflammatory response in the body through its communication with various histamine receptors. So there's 4 different classes of histamine receptors. Our H1 receptors are more our typical allergic response. H2 tends to have more of an effect in our gut and our gastric secretions. And then H3 and H4 are typically more nervous system related. And while histamine does get a bad rap because it causes a lot of symptoms, we need it. We need histamine in our body to bring immune cells to the site of an infection and help our body's immune system, again, in a beneficial way. It also stimulates the production of stomach acid. It can act as a neurotransmitter, which can impact sleep and appetite and mood. So even though the release of histamine can cause a lot of symptoms in people, it also is very important, and we need histamine to live. And then here we're going to go more into detail on the differences between histamine intolerance and MCAS. So we're kind of veering away from general allergies right now, and I want to focus more on these 2 things. Really, I'm going to focus more on MCAS. So histamine intolerance, and then another important thing to know before we dive into this is that you can have both of these. You can have histamine intolerance and MCAS, or you can have MCAS and not have histamine intolerance. So they don't necessarily come together, especially if you look at the percentages. So histamine intolerance is more rare, expected about 1 to 3% of the population, whereas MCAS, even though it's more complex, is more common, estimates of around 17% of the population. I think that's probably even a little bit higher. And then another thing to preface is that I wouldn't consider myself an expert in MCAS, though I'm very aware of it, and I've done a lot of additional training and listened to a lot of podcasts about MCAS. I wouldn't consider myself an expert. It is extremely complex, but a lot of my patients come in with a diagnosis of MCAS already, or I'm starting to see it more and more in practice, helping to connect the dots with some of my patients, going over the symptoms, and then seeing that light bulb moment happen, which is one of the reasons why I love being a naturopathic doctor, is to experience those moments with my patients when they're like, this is what's been going on for 5, 10, 20 plus years. And so circling back, histamine intolerance is when there is either too much histamine being produced. More commonly, it's from a harder time breaking down histamine, though. So there's histamine and your body is having a hard time getting rid of it. So it's primarily related to a reduced activity of a very specific enzyme in the body called DAO, and that's the enzyme that breaks down histamine. And when histamine is broken down, you're not going to have all of those symptoms of high histamine. And so symptoms for histamine intolerance are typically triggered by ingestion of histamine-rich foods or substances that release histamine or substances that can inhibit the DAO enzyme. We'll talk about histamine-rich foods on the next slide. And again, this one's a little more rare. People with histamine intolerance typically will do well on a low histamine diet. That can be really restrictive. So that's something that's really important to go over with your provider if you do want to experiment with a low histamine diet. Or there's also the possibility of taking DAO enzyme in a supplement form. So you're essentially just taking that enzyme that your body may be not producing or not having enough of. So that's histamine intolerance. And then MCAS is different. So these terms, again, might be used synonymously if you're seeing them on social media, but they are very different. So MCAS is characterized by inappropriate and excessive activation of the mast cells. And those mast cells release so many different mediators, including histamine, but again, also including tryptase and prostaglandins and leukotrienes. And so our mast cells are releasing all these mediators. The number is still, I would say, unknown. Some people say hundreds of different mediators. I've heard thousands of different mediators. And so there's a lot that can be released. And then the testing for MCAS, which we'll talk about later, goes into more of what different mediators can you look at when you're suspecting that MCAS is happening. Again, it's more complex because there's so many different organ systems that are typically involved in MCAS. That's part of the diagnosis of MCAS, actually, is that you need to be having symptoms in more than one area of the body. And so it says it right there. Symptoms are episodic and involve at least 2 organ systems. So we'll go over the symptoms of MCAS later. First, we're going to go over histamine-rich foods. So high histamine foods common are going to be anything fermented. So think, kimchi, sauerkraut, sourdough, things like that. Smoked meats and deli meats, citrus fruits, bananas, avocados, strawberries, tomatoes, cheese, beans. You can see there's a lot of really healthy foods that can be high in histamine and can cause a lot of symptoms for people. So a histamine-free diet or a low histamine diet, I will use occasionally in people to see, is it more of an issue with that histamine breakdown? Someone with MCAS can improve by doing a low histamine diet, but to me, that's not necessarily getting to the root. For histamine intolerance, it might be, but for a lot of other conditions, it's more so, in my experience, more of a Band-Aid to really just lower that histamine load. And so, yep, that's kind of an overview on those high histamine foods. Feel free to screenshot this if you want to look a little further. Some lists do have some variability, like I see eggs here, and other lists don't include eggs. So it's a little tricky to know really what is the highest histamine food. Leftovers is a big one, though. Leftovers will definitely have higher histamine loads than fresh cooked foods. And so something to keep in mind is just if you're having a lot of histamine-like symptoms, allergic, MCAS type symptoms, to either do a food diary or keep an eye on, I had strawberries and then I had all of these symptoms happen, or I had tomatoes and I started to feel allergic. So that's just a general overview. And then symptoms of MCAS. So symptoms of MCAS, again, are going to be so variable because they're in different areas of the body. So I might actually need to zoom up. If we're looking at the one on the right, from a skin perspective, there can be flushing and itching and swelling and hives, respiratory, more nasal congestion, shortness of breath, digestion, constipation, diarrhea, could be a mix of both, abdominal pain, vomiting. In the neuro section, we have headaches, trouble thinking, brain fog, numbness, tingling. One thing I've seen pretty commonly is also after exercise, having some of these little, almost like pinpricky type sensations, or feeling like it's hard to describe, but like little activations within the muscle. Musculoskeletal, joint pain, muscle weakness, cardiovascular, fast heart rate, heart palpitations, weakness or fainting. And then anaphylaxis can also happen in people with MCAS. And then this one on the left, I also like because this goes a little more in detail in that top left of, anxiety, depression, OCD, insomnia, panic attacks. Anxiety is a huge one. So anxiety is very, very common with MCAS and having a higher histamine load, or again, a higher mast cell mediator load. And it's important to know that these things could obviously represent so many other conditions, so many other diseases. So it's really important to work with a provider who is aware of that and are ruling out other things, and then eventually getting to this MCAS diagnosis. It's not going to be most likely the first diagnosis that comes to mind for a provider. It's going to be something where so many other things have been looked at, and then that moment clicks, typically more for the patients, and then they bring it into the providers, because a lot of these patients have been struggling with these symptoms for so long that they're doing their own research. They're listening to the podcast, reading the books, scanning Reddit, looking for answers because they haven't found answers yet. That's another reason why I love what I do, because my hope is that I prevent those years and years and years of patients having to do their own digging and research, because that's what I'm doing. So yeah, just a little tidbit there. And then MCAS triggers. This can be so variable for people. So it doesn't mean that all of these things need to trigger that mast cell release and that mast cell mediator release. But these things can be triggers or are more common triggers. So foods, think again, those high histamine foods, but it could even be a low histamine food that's a trigger. Alcohol is a very common one. Exercise, temperature changes, so fluctuations in temperature, hot and cold, even like weather changes can be a change. And then hormonal changes. This one's really interesting because I would say in most other hormonal conditions, having mid-follicular phase symptoms is pretty rare. I would say the majority of my patients, when that estrogen is climbing, they're feeling good, they're feeling confident and more energetic. But for people that have MCAS in that mid-follicular phase, when estrogen is rising, they may actually have more symptoms because estrogen is histamine promoting, whereas post-ovulation, when we have that progesterone rise, progesterone tends to be mast cell stabilizing. And so the 2 times of the cycle where we're having those estrogen peaks are going to be right in that mid-follicular phase, typically around day 8, day 9 of your cycle, and then also around ovulation, which can vary for everyone between days on average 13 to 16 or 17. And so if you're noticing worsening symptoms around those 2 times, which again, that mid-follicular phase is a little more rare, that's definitely something to bring up to your provider and try to track in whatever app you're using, on a calendar. Just tracking those associations can be really helpful too. And then let me just see. Okay, I just want to look at the chat too. I don't know if we can get copies of slides, but this is going to be posted on YouTube eventually, I think next week. And so, but I can always message you a copy of the slides. So, okay. And then let me go back to slides. Okay. So MCAS triggers. So there's a lot of different potential triggers. Again, we're going through the hormonal changes. Stress is a really big one. So stress is one that from time to time, when there's big changes, that is a common theme that I see in a lot of my patients with MCAS, where when they're younger, it's maybe just a little assortment of symptoms. And then they go to college, or they get a job, or they have their first child. Lots of different things could be that tipping point almost, where now you're realizing and recognizing all of those symptoms. Medication can be a trigger. There's a lot of different medications that are MCAS triggers. And so that's something that if you're interested in those, let me know. I can send you a list of them. And then chemicals in the environment. So a lot of people with MCAS are very sensitive to fragrances. And that's why you'll see more and more, maybe not the only reason, but why a lot of offices have a fragrance-free policy, because a lot of people can have a lot of symptoms from just being exposed to someone's perfume. Whether that's, again, headaches, dizziness, anaphylaxis even. There have been cases of individuals with MCAS having an anaphylactic response to someone's fragrance. And so all the different triggers. Diagnosis. So diagnosis can be very, very tricky. And I think that that's what is potentially making it hard for people to get diagnosed, or even for clinicians to know which criteria to use. So there's an initial consensus that's considered just the consensus that was published in 2012. And that one is viewed as more strict, I would say, and potentially leading to underdiagnosing because of how strict it is in needing to see elevated tryptase levels. Whereas the consensus 2, I would say, has a little bit more, not flexibility, but looks at a lot of different things. And so the downside potentially to consensus 2, and this is even known in the literature, they say it themselves, is that it could potentially overdiagnose people. So with that, you kind of have to look at both of them. I think it's helpful for clinicians that are diagnosing MCAS to know about both of them. But I would say the majority of people that I'm aware of are using more of the consensus 2 criteria. And so when we're looking at consensus 2 here, there's major criteria and then minor criteria. So a diagnosis can be made by either having both major criteria met or having the second major criterion plus any one of the minor criteria, or by having 3 of the minor criteria. And so within this is where we come into some of the testing for MCAS, which has a lot of, again, like complexity, because for a lot of the tests, a lot of those mast cell mediators, they're very temperature sensitive. And so you have to get it drawn from a lab that has a centrifuge that is essentially cooled or cold. Can't just be a regular centrifuge like we have here in the office. It needs to be chilled. And then the tube has to be chilled before the blood draw, must remain chilled afterwards. Same thing for some of the urinary collections. And so that is something that can, even if you get all these tests done, if the processing of that test is not done in a very strict way, that could cause those results to be negative, to be low, and for them to, again, not indicate that you could have MCAS going on. So part of the consensus 2 that is helpful is that one of the minor criteria is that you have a positive response to mast cell therapy. And so within mast cell therapy, we have our antihistamines, which are our H1, we have our H2 antihistamines, which is going to be more so Pepcid, and then we have mast cell stabilizers, we have the leukotrienes, and so we'll go over those in mild detail, but those are something that, those things are helpful because part of that minor is that you try something that stabilizes, helps to block those mast cells, and you get better. So that can be something that's used when having access to some of these additional tests is really hard to come by. Another thing that I was just listening to is that the tryptase, which again was more in that criteria 1, is only positive in about 15% of people with MCAS. So that's why that first consensus is not being used as much, to my knowledge, and people are really more leaning towards that consensus 2, because you don't necessarily need to have an elevated tryptase, or a lot of people with MCAS, 85% of the population that has it won't have an elevated tryptase. And so that's where some of the nuance comes in with the diagnosing of MCAS. Okay, and then the pentad. I can't talk about MCAS without talking about the pentad. So this is how I got interested, familiar, exposed to MCAS, because I have so many patients that have hypermobile EDS, which is a connective tissue disorder. I did a webinar on that, I think 6 months ago. And so it's very common in the population of people with EDS or connective tissue conditions, so hypermobility spectrum disorders, to have MCAS. Similarly, POTS, autoimmunity, gastroparesis. So there was the triad, there's now the pentad, there's even more that are being connected to EDS, but our mast cells live in our connective tissue. So if there's already an inherent issue in the connective tissue, MCAS is very commonly seen in the EDS population. I would say the majority of my patients with EDS have, I don't want to say MCAS diagnosed, but have symptoms that are, again, suggestive of MCAS or a histamine, a mast cell mediator difficulty with processing. So Just wanted to throw that in there because that's really how I have gotten more awareness about MCAS, what it is. But again, you can have MCAS and not have EDS. So there is more research too showing that, or suggesting that post-COVID syndrome could be mast cell mediated, and that post-COVID symptoms could really be MCAS, and treating post-COVID with MCAS type treatments. Okay, so treatment for MCAS. I mean, the very important first step is identifying and removing triggers to your best ability. So identifying if there are specific foods, if there are body care, skin care, fragrances that you're using that are triggering more symptoms. And again, because you can have the symptoms in the different body areas, it can be hard to really identify them, but that's where it's helpful to work with someone, go over your day-to-day routine, how you're feeling throughout the day, and then potentially have a diary, a log, something that is going to help to further break down what are the potential triggers. And then step 2, typically the first thing that I'll do with people is try a very specific antihistamine regimen, which has both the histamine 1 and the histamine 2s in there. The histamine blockers. So I'll have people do Zyrtec, Allegra, Zysol, 1 tablet morning and night. This is also not medical advice. Please don't try this without talking to a provider. Just telling you what I have my patients do. But I'll have them do, again, an antihistamine morning and night plus Pepcid, typically morning and night, for 2 to 4 weeks to really see how much does that improve their symptoms. I've had some patients with PMDD and headaches and chronic pain. This was the only thing that we did, and all of those symptoms improved, which was miraculous to me. The more and more I learn, I guess it doesn't necessarily need to be miraculous, but I was like, whoa, this is all we changed, and all of those symptoms improved. And so that's typically part of step 2, is trying that with people. What can be really tricky is for my very, very sensitive people is they could actually negatively react to those antihistamines if there are additional excipients, or again, like those inactive ingredients in those products that they're having a histamine response to, or again, a mast cell mediator response to. Another important thing to think about before moving on to step 3 is that not everybody with MCAS is going to have allergic symptoms. So you would think that most people with MCAS are going to have like a pretty significant allergic response that doesn't have to be there for someone to meet the criteria for MCAS. And so if someone doesn't get better with the histamine 1 and histamine 2 blockers, it's still important to consider MCAS and to either try some of these other medications, try supplements. Again, a lot of this is going to be trial and error and figuring out what works best for people. So other medications to consider would be mast cell stabilizers like cromolyn sodium that can be very tricky to get and to get covered by insurance. And again, they come typically in plastic ampules. So if people are sensitive to plastics, then they could react to that as well. Other medications like leukotriene modifiers, so montelukast is an example of that. And then the injectable Xolair is pretty impressive. I've had a lot of really sensitive patients do well with that. But again, that's going to stay in your system for longer than some of these other medications. And so if you are highly sensitive, that is something I don't prescribe. People will go to an allergist and be monitored when they have their first injection, but that is something that I have seen help my patients that have MCAS. And then, yeah, steps 4 plus going on is trial. So trialing other supplements and nutrients, dietary changes, lifestyle modifications, really digging deep to see, again, what things could be contributing. So, and we'll talk about those. Okay, gut health, and again, histamine intolerance or MCAS or even allergies. This is something that I have been seeing more and more, and it's tricky to explain exactly what's going on, but a lot of times I will have people come in with symptoms of histamine intolerance, MCAS, or even just like normal allergies, and we'll look further at their gut health and treat their gut, and then those symptoms significantly get better. While where they're doing treatment for their gut, their sinus congestion goes away. or they have hives, and all we do is an antimicrobial herbal support for their gut, their hives are gone. And then if there is still that imbalance happening, if there's something driving that imbalance, they'll typically come off of either that supplement or an antibiotic, and then those symptoms will come back. And so I do think that there is a very strong connection between our microbiome and histamine. There are certain bacteria that actually are able to digest histamine. There are, again, that histamine digesting enzyme that's going to also be within our gut microbiome. And so that's something to keep in mind, is anytime there is a histamine allergy MCAS type of presentation, as I want to think about what's going on in the gut and do some more digging, whether that's doing some testing, doing some empiric treatment, trying different probiotics, adjusting things again dietary wise, to see if there could be a strong connection with their microbiome and what's going on with their symptoms. Naturopathic treatment. So this is where it gets fun. Again, these lists are not all inclusive, or you don't need to do all of these things. This is where working with a provider is so important, because everybody is different. Everyone's going to react differently. Some people might have allergies to some of the things that I list in the next few slides. And so please don't see this slide and go out and buy all these different things and try them without guidance, because I think that that's a really important piece of treatment. So specific nutrients and herbs. I put these 2 products on here, but you don't need to use these products. Those are just things that I use commonly. So typically for my more sensitive MCAS patients, I will do single ingredient supplements to, again, try to stabilize those mast cells. So quercetin, vitamin C, those are 2 really good mast cell stabilizers. Vitamin D is very important for its immune modulating, anti-inflammatory, honestly, everything. Vitamin D is so important for so many things. So that one is an important one to make sure is in good levels in your labs. B vitamins can be more stabilizing, probiotics, of course, but all probiotics are not created the same. So there's some probiotics that can actually worsen people's symptoms, whereas there's others that can help improve symptoms, and there's so many different strains. So again, generally stating probiotics here, but that can vary. Stinging nettle is a very good herb that can be, again, stabilizing to those mast cells. It's very nutritive. NAC, so N-acetylcysteine, that one is very good too for congestion. DAO, the enzyme, resveratrol, perilla, and then the PEA at the bottom. That one I don't use too much, but I have heard good success with it. I just stick to some of the other ones. And so these are different things that can be used. And again, depending on people's sensitivity, we might bring things in one at a time, and not even do a full capsule. Do half of a capsule of something and see how your body responds. And again, that really just depends on how sensitive the person is. Typically, you'll know if you're very sensitive to medications and supplements. And then diet, again, these are not across the board recommendations, especially because a low FODMAP diet and a low histamine diet can be very hard to implement, but it can be useful in a short term to see how much improvement does someone get with just dietary changes alone before potentially adding in supplements, adding in medications. And so something to think about, there has been good research on gluten, yeast, and cow milk protein-free diets for MCAS. And so another thing to consider, but again, these can be really hard. So I wouldn't recommend people just try them without guidance, because I always want to ensure that my patients are getting enough calories, they're eating enough, they're, again, getting good nutrition in and not just eliminating a bunch of foods. So, but some of those changes can be really significant for people. Lifestyle, these are going to be generally good for anyone with allergies, not necessarily just for people with MCAS. So having a vacuum that has a HEPA filter on it, and getting an air filter that's HEPA, wiping down dust with a damp mop or a cloth to really reduce those dust mites, because a lot of people are going to be allergic to those. Making sure that when you're washing your bedding and your clothing, you're using hot water. Another thing too is, even if you showered earlier in the day, if you've been outside, walking around, interacting with the environment, doing even just a simple hot shower before you go to sleep You don't necessarily need to wash everything again if you already did in the morning, but you could do a hot shower so then you don't have a bunch of allergens potentially in your hair that you're rolling around when you're sleeping. Reducing rugs, curtains, just excess fabric, again, to your best ability. So some homes are going to have carpet in them. And for some people, replacing that flooring could make a huge difference. For other people, it might not. So it's really hard to know because, again, a lot of these can be pretty intensive things to do. And then a humidifier or a dehumidifier. I would say here in Arizona, we're typically going to need more of a humidifier than a dehumidifier, but just making sure that the moisture level in the air is where you want it, and not too high or too low. And then changing fragrances or changing body products to fragrance-free. Honestly, I would prefer everybody do this, not just people with allergies, because we know that fragrances are endocrine disrupting. And so to your best ability, and again, this is not something where you need to go throw out everything, but the next time you're due for a new shampoo and conditioner, maybe get a more clean, low tox option versus getting the same one. So another important thing to think about. Limbic retraining, I would say this is going to be more focused for the MCAS world. These are just some different examples of limbic retraining programs, really focusing on that stress response and teaching your body that you're safe. And this can be a really big piece for MCAS treatment because there typically is some type of nervous system component going on, whether that's within dysautonomia of POTS or chronic stress. So these are just some different programs that I have heard good things about from my patients. Medication, so those MCAS specific medications I spoke about prior, then there's specific nasal sprays. Again, these are going to have variability. There's going to be more natural nasal sprays that you can use, and then more medication-based nasal sprays, allergy shots, the SLIT, which is the sublingual immunotherapy. So there are things that can be, again, extremely helpful. So I'm not anti-medication. I like to use what we can naturally first, or from an herbal nutrient perspective, but some medications can be life-changing for people. And so I am not opposed to them across the board. That's, again, part of my approach to naturopathic medicine is being very integrative and getting people to feel better. That's really my goal. How we do that can vary person to person. So I think that's all. Whew, that was a lot of talking. Okay, well, I am going to go ahead and end this here. But if any of you have any questions, if you're my patients, feel free to message me in the portal. If you are a patient of another provider here at Living Wellness, feel free to message them. They can always reach out to me if they have any questions. We are all very close. So we have lunch together. We talk about cases. So if you need some additional support, just let me or let them know. And I hope that this was educational and helpful, and not too much, but also not too little. So I hope you all have a good weekend, and I'll talk to you all later. Bye.